Welcome to today's video about symptoms of thyroid. Have you ever wondered why some people suffer from constant fatigue, unexplained weight changes, or persistent neck swelling, yet never suspect it could be their thyroid? Shockingly, over 200 million people worldwide are affected by thyroid disorders, many of them undiagnosed. That's right, millions are living with symptoms that could be warning signs of something far deeper, but they simply go unnoticed. Now, here's the real question. What if the fatigue that drags you down each morning, the stubborn weight that refuses to budge, or that swelling at the base of your neck isn't just part of getting older? What if it's your thyroid silently crying for help? According to the American Thyroid Association, 1 in 8 women will develop a thyroid disorder during her lifetime. That's a staggering figure, yet so many live without answers, struggling through symptoms that could be easily managed if only they knew what to look for. In this video, we're uncovering the top symptoms of thyroid problems, signs that are often mistaken for everyday issues. Some of these symptoms might surprise you, and recognizing them early could change everything. Stick with us because the third symptom on our list is one that most people ignore until it's too late. You won't want to miss it. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. All right, let's dive into the key symptoms of thyroid issues, beginning with the very first one: fatigue and weakness. When you wake up feeling exhausted, even after a full night's sleep, it's easy to blame it on stress or poor rest. But constant fatigue and lingering weakness can sometimes point to something deeper: thyroid dysfunction. The thyroid gland, nestled at the base of your neck, is responsible for producing hormones that control how your body uses energy. When it doesn't produce enough of these hormones, a condition called hypothyroidism, your metabolism slows down drastically. This means every cell in your body is running on low energy, leaving you feeling drained, even with minimal activity. A study published in the Frontiers in Endocrinology in 2024 found that over 75% of people with hypothyroidism experience chronic fatigue as one of their main symptoms. Researchers explained that when thyroid hormone levels drop, the body's ability to generate energy from food decreases. Muscles, which are highly energy dependent, begin to feel weak and tired, even with simple tasks. This isn't just ordinary tiredness, it's a profound sense of fatigue that doesn't improve with rest. It's like trying to drive a car with an empty fuel tank. It struggles to move forward. If you're constantly feeling worn out without a clear reason, it might be more than just a busy lifestyle. Maybe it's time to consider if your thyroid is whispering for attention. Next, number 2, weight changes. When you notice the scale creeping up or dropping without any major change in your diet or exercise routine, it might be more than just lifestyle. Thyroid hormones play a huge role in regulating your metabolism, which is how your body burns calories and uses energy. If your thyroid is underactive, known as hypothyroidism, your metabolism slows down dramatically. This means your body holds onto calories instead of burning them efficiently, leading to weight gain. You might find yourself putting on pounds even when your eating habits haven't changed. It's not just fat gain. Sometimes it's water retention too, making you feel puffy and swollen. On the flip side, an overactive thyroid or hyperthyroidism can speed up your metabolism. This condition causes your body to burn through calories at a rapid pace, often leading to unexplained weight loss. You might feel hungrier than usual, but still lose weight because your body is burning energy so fast. According to a 2019 study published in Clinical Obesity, around 60% of patients with hyperthyroidism experience significant weight loss within the first 6 months of diagnosis. This research underscores how sensitive our weight is to changes in thyroid function. If you've been struggling with unexplained weight changes, it could be your body's way of signaling a deeper issue. Next, number 3, hair loss. Imagine running your fingers through your hair, only to find more strands than usual left behind. It's easy to dismiss it as seasonal shedding, but there's often more to the story. Thyroid imbalances, both hyperthyroidism and hypothyroidism, are known to disrupt the normal hair growth cycle. This tiny gland in your neck produces hormones that regulate nearly every aspect of your metabolism, including hair growth. When hormone levels are off, it sends shockwaves through the delicate rhythm of hair growth, rest, and shedding. Now, here's where it gets interesting. Research published in the Coreus in 2023 found that people with untreated hypothyroidism experience noticeable hair thinning or patchy hair loss. Unlike regular shedding, thyroid-related hair loss isn't limited to your scalp. You might also notice thinning eyebrows, especially the outer third. This happens because thyroid hormones, specifically T3 and T4, are crucial for maintaining the growth phase of hair follicles. When levels are low, hair strands enter the resting phase too soon, leading to excessive shedding. What's even more surprising is how quickly it can happen. Some patients report dramatic changes in just a few weeks. This isn't just cosmetic, it's your body signaling that something is off. If your brush is fuller than usual, it might be time to consider a deeper look into your thyroid health. Next, number 4, dry skin and brittle nails. When your thyroid isn't working properly, your skin can feel the effects. That constant dryness, flakiness, and rough patches might be more than just a need for better moisturizer. The thyroid gland controls how your skin cells renew and repair themselves. When hormone production slows down, so does skin turnover. This leads to dead cells piling up on the surface, making your skin look dull, dry, and even cracked. And it doesn't stop there. Your nails can suffer too. Brittle, peeling, or ridged nails are a clear sign that your body is struggling to keep up with normal growth cycles. What makes it happen? It's all linked to thyroid hormones, specifically T3 and T4. These hormones play a role in blood circulation and the delivery of nutrients to your skin and nails. With hypothyroidism, blood flow slows down, starving your skin and nails of essential nutrients and oxygen. A 2020 study published in the Anais Brasileiros de Dermatologia found that people with hypothyroidism experience noticeable changes in skin texture and nail strength. This isn't just coincidence, it's a biological response to reduced hormone levels. If your moisturizer isn't cutting it and your nails keep cracking, maybe it's time to consider what your thyroid is trying to tell you. Next, number 5, depression and mood changes. When energy levels drop and sadness lingers longer than it should, it's easy to point fingers at stress or life challenges. But sometimes, the real culprit is hidden in the neck, your thyroid gland. This small gland has a powerful influence over your mood and emotions. When it's not producing enough hormones, it can throw your mental well-being off balance. Low levels of thyroid hormones, particularly T3 and T4, slow down brain function, leading to feelings of sadness, anxiety, and even depression. Studies have shown that nearly 60% of people with hypothyroidism experience mood changes, often mistaking it for typical emotional struggles. The reason is biochemical. Thyroid hormones help regulate serotonin, the brain's mood stabilizer. When hormone levels drop, serotonin production declines too. That's when you start feeling blue, unmotivated, or even disconnected from daily life. A 2022 study published in the Pharmaceuticals found that treating thyroid imbalances significantly reduced symptoms of depression in patients within just a few months. This isn't just a mood swing, it's your body signaling that something deeper might be off. If those low days seem to be stretching longer and affecting your daily life, it might not just be in your head. It could be your thyroid asking for attention. Next, number 6, brain fog. You know that feeling when you walk into a room and completely forget why you're there? Or when you struggle to find the right words during a conversation? That fuzzy, disconnected state is what many call brain fog, and it's a real struggle for people with thyroid issues. When the thyroid isn't producing enough hormones, it slows down many of the body's processes, including brain function. Research published in the Journal of Clinical Medicine in 2022 found that patients with hypothyroidism showed a 22% decrease in cognitive processing speed and a 17% reduction in memory retention compared to those with normal thyroid levels. This happens because thyroid hormones, especially T3, are crucial for brain health. They help regulate neurotransmitters like serotonin and dopamine, which are linked to mood and clarity of thought. When those hormone levels drop, it's like your brain is trying to work through thick fog. Concentration becomes harder, and even simple tasks can feel mentally exhausting. That's why many people with thyroid problems report not just fatigue, but real struggles with memory and focus. If it's hard to keep your thoughts straight or recall information quickly, it might be your thyroid waving a red flag. Ignoring these signs can lead to deeper cognitive issues over time. Addressing thyroid health can often clear that fog, bringing back sharper focus and mental clarity. Next, number 7. Cold or heat intolerance. When your body struggles to maintain its internal temperature, it's not just about feeling a little chilly or too warm. It's often a clue that something's off with your thyroid. This small gland in your neck is like your body's thermostat, controlling how much heat you produce and how efficiently you use energy. When the thyroid is underactive, known as hypothyroidism, your metabolism slows down. Less energy is burned, and your body produces less heat, leaving you shivering even when everyone else is comfortable. You might find yourself reaching for a sweater in 25 degrees Celsius weather or cranking up the heater while others are perfectly fine. On the flip side, an overactive thyroid or hyperthyroidism can rev up your metabolism to overdrive. This makes your body burn energy too fast, creating excess heat. You may sweat more than usual, feel uncomfortably warm in cool environments, and find even mild exercise leaves you drenched. A study published in the Primary Care Companion for CNS Disorders in 2023 found that hyperthyroid patients reported unusual sensitivity to heat, while those with hypothyroidism struggled with cold intolerance. These symptoms are not just discomfort, they're clear signals that your body's internal balance is disrupted. If you've been battling with unexplained chills or sweats, it might be more than just the weather. It could be your thyroid asking for attention. Next, number 8, muscle aches and joint pain. When your thyroid isn't working as it should, your muscles and joints often pay the price. This tiny gland in your neck produces hormones that control how your body uses energy. When those hormone levels are off, your muscles can become weak and sore, while your joints may feel stiff and achy. It's not just random discomfort, it's a direct result of your body's slowed down processes. Low thyroid hormone levels reduce blood flow to your muscles, limiting oxygen and nutrients that keep them healthy. Over time, this lack of nourishment leads to inflammation and pain. Recent research published in the Journal of Clinical and Translational Endocrinology, 2024, found that individuals with hypothyroidism reported chronic muscle pain and joint stiffness, often mistaking it for aging or regular wear and tear. The study highlighted that the pain isn't just a surface issue, it goes deep, affecting muscle fibers and surrounding tissues. Researchers noted that thyroid hormones play a critical role in maintaining muscle protein synthesis. When hormone levels drop, muscle breakdown outpaces repair, leading to weakness and discomfort. If you've been noticing unexplained aches that linger or seem to worsen, it might not be just your lifestyle. It could be your thyroid calling for attention. Next, number 9, constipation or diarrhea. When the thyroid gland isn't functioning properly, it disrupts more than just energy levels. It can throw off your entire digestive system. An underactive thyroid, known as hypothyroidism, often leads to constipation. This happens because thyroid hormones like T3 and T4 are crucial for maintaining healthy gut motility. When these hormone levels drop, the digestive process slows down. Food moves sluggishly through the intestines, resulting in hard, infrequent stools. A study published in the Frontiers in Physiology in 2024 found that nearly 45% of individuals with hypothyroidism experience chronic constipation. This is because low thyroid hormone levels reduce the muscle contractions needed to push food through the digestive tract. On the flip side, when the thyroid is overactive, a condition called hyperthyroidism, the situation reverses. The excess production of thyroid hormones speeds up gut motility. This rapid movement doesn't allow the intestines enough time to absorb water from the stool, leading to diarrhea. People with hyperthyroidism often report frequent, loose bowel movements. The same 2024 study highlighted that hyperthyroid patients experience chronic diarrhea, pointing to a clear connection between thyroid health and digestive regularity. Your gut may be telling you more than you think. If these symptoms persist alongside other signs of thyroid imbalance, it's worth discussing with your doctor. Next, number 10, menstrual irregularities. Thyroid health plays a crucial role in maintaining a woman's menstrual cycle. Both hypothyroidism and hyperthyroidism can disrupt the delicate balance of hormones that regulate your monthly cycle. An underactive thyroid often leads to heavier, more prolonged periods, while an overactive thyroid can cause lighter or even missed cycles. This happens because thyroid hormones directly influence the production of reproductive hormones like estrogen and progesterone. When these hormone levels are out of sync, it affects how your uterus builds and sheds its lining each month. A research published in the Fertility and Sterility 2000 found that women with hypothyroidism are 2.5 times more likely to experience menstrual irregularities compared to those with normal thyroid function. The study also revealed that women with untreated thyroid issues reported irregular cycles. This isn't just an inconvenience, it's your body signaling that hormone imbalances are affecting your reproductive health. If you've been noticing unpredictable periods or changes in your cycle's length or flow, it might be worth exploring your thyroid health. This small gland holds more power over your body than you might think. Next, number 11, high cholesterol levels. Cholesterol levels can sometimes be more than just a dietary concern. If you've been eating right and exercising but your cholesterol remains stubbornly high, it might be pointing to an issue with your thyroid. The thyroid gland, responsible for producing hormones like T3 or triiodothyronine and T4 or thyroxine, plays a significant role in breaking down cholesterol circulating in your bloodstream. When thyroid hormone levels drop, especially in hypothyroidism, this process slows down, causing cholesterol to build up. In fact, research published in the BMC Endocrine Disorders in 2025 found that nearly 30% of people with untreated hypothyroidism experienced elevated LDL cholesterol, regardless of their diet or lifestyle changes. This buildup isn't just a minor inconvenience. It can lead to plaque formation in arteries, increasing the risk of heart disease. The study also showed that treating thyroid imbalance helped reduce LDL levels significantly, highlighting how crucial proper thyroid function is for heart health. Ignoring this connection can be risky, especially since high cholesterol often has no obvious symptoms until problems arise. If you've been struggling with cholesterol despite a healthy lifestyle, it might be worth checking your thyroid function. It's a simple test, but it can reveal a critical link that might just change your health outlook. Next, number 12, edema. Waking up with puffy eyes or noticing your socks leave deep impressions on your ankles. These subtle signs might be more than just daily fatigue or tight footwear. They could indicate fluid retention linked to thyroid issues. In hypothyroidism, the body's metabolism slows down due to insufficient thyroid hormone production. This slowdown affects the lymphatic system, which is responsible for draining excess fluids. When it's sluggish, fluids can accumulate in tissues, leading to swelling, especially in the face, hands, and legs. A 2020 study published in the Epidemiology of Thyroid Disorders highlighted that patients with untreated hypothyroidism often exhibit non-pitting edema, a type of swelling that doesn't leave an indentation when pressed. This is attributed to the accumulation of mucopolysaccharides in the skin, substances that attract water and cause puffiness. If you've been experiencing unexplained swelling, it's essential to consult with a healthcare professional. A simple blood test can determine thyroid hormone levels and guide appropriate treatment. Addressing the root cause can alleviate the discomfort and prevent further complications. Next, number 13, palpitations or slow heart rate. That quick fluttering in your chest or the feeling that your heart is dragging its feet can be more than just a passing sensation. Thyroid imbalances often affect heart rate, causing either palpitations or a sluggish heartbeat. This happens because the thyroid hormones, specifically T3 and T4, are powerful regulators of your heart's rhythm and strength. When the thyroid is overactive, as seen in hyperthyroidism, it floods your system with these hormones, speeding up your heartbeat and sometimes making it feel like it's racing for no reason. You might notice your heart pounding even when you're just sitting still. This isn't just uncomfortable, it can strain your heart over time, increasing the risk of complications. On the other hand, an underactive thyroid, hypothyroidism, slows everything down. Your heartbeat becomes sluggish, and you might even feel dizzy or lightheaded. This slowdown is because low thyroid hormone levels reduce the heart's ability to pump effectively, leading to poor circulation and fatigue, according to a study published in The Curious. In 2023, people with untreated hypothyroidism are more likely to experience bradycardia, a condition where the heart beats too slowly. Feeling those flutters or a dragging heartbeat isn't something to ignore. It's your body's way of signaling that your thyroid might be out of balance. Next, number 14, goiter, A subtle swelling at the base of your neck might seem harmless, but it could be your body's way of signaling a thyroid imbalance. This enlargement, known as a goiter, often arises when the thyroid gland is overworked or under attack. For instance, in iodine-deficient regions, the thyroid enlarges to compensate for the lack of iodine, a crucial element for hormone production. This adaptation can lead to noticeable neck swelling and, in severe cases, breathing or swallowing difficulties. Autoimmune conditions also play a significant role. Hashimoto's thyroiditis, where the immune system targets the thyroid, is a leading cause of goiter in developed countries. A 2024 study in the International Journal of Surgery Open found that 54.8% of patients with chronic autoimmune thyroiditis presented with diffuse goiter, highlighting its prevalence in such disorders. Advancements in medical imaging have shed light on the nature of goiters. A 2024 study published in Endocrine emphasized the importance of ultrasound in assessing thyroid nodules and goiters, aiding in accurate diagnosis and management. If you notice a persistent swelling in your neck, it's essential to consult a healthcare professional. Early detection and appropriate management can prevent complications and ensure optimal thyroid health. And that's it for today's video. I hope you now have a clearer understanding of how those everyday symptoms could be linked to your thyroid. If you found this information eye-opening or helpful, take a moment and type "helpful" in the comment box below. Your feedback truly inspires us to create more content just like this. If you haven't already, don't forget to like, share, and subscribe for more health insights and natural remedies that could transform your well-being. And hit that notification bell so you never miss out on our latest updates. Remember, understanding your body is the first step to better health. Thank you for watching, and we'll see you in the next video. Stay healthy and take care.